Good afternoon to the Find Your Fire tribe. It's another wonderful Fire Friday. And I'm so pleased to be here with you because, as you know, I've been off with the dreaded bug and I've been unable to join you live for the last couple of weeks. So this is a really special occasion that I can be here. And today's session is going to be a very intriguing and interesting one with Dr. Leah Pouchet. She is going to be talking to you and to us about healing animals the holistic way. Now, if you're joining us live on Facebook, please be sure to type #live and ask any questions if you like in the chat, because I will be monitoring the chat. And if you watch the replay, type #replay so that we know you were here and that you have enjoyed the session. So without further ado, I'd like to introduce Dr. Leah Pouchet. Welcome, and thank you so much for being with us, Leah.
Hi, Wendy. Thank you for inviting me.
No, it's our pleasure. I'm so, we had to put off the last session. I'm so glad we were able to do it today.
Yes.
Anyway, Leah, I know that you are you live in Trinidad and you're a vet and you have you're a partner in a practice. Could you give us a little bit of background about your journey to being a vet, first of all?
Sure. Well, I've always loved animals, of course. You kind of have to love animals to be a vet. And then from there, graduated in 2009, and around 2013, 2014, started studying acupuncture. And from there, it's kind of a cascade effect. Once you start holistic medicine, then you realize all the different avenues and branches that you can take from there.
You were saying that you graduated as a vet in 2009. What did you do when you graduated? Were you practicing traditional medicine then at that time?
Yes, practice regular, what we call Western veterinary medicine, as opposed to Eastern or traditional Chinese veterinary medicine. And the Western medicine, basically, from one small clinic to the next, until I found a little niche, and yeah, I switched jobs a couple of times.
Where is your little niche?
Right now, I work in Sapphire Vets Limited. I have a business partner, Dr. Renee Lizama Driscoll, and we have a clinic as well as a house call service. We do mixed practice, which means we do everything from exotic up to equine, and yeah, it's exciting to have the variety.
When you say exotic, what do you mean, Leah?
Okay, so from veterinary medicine, exotics are classified as anything from a hamster to bird to turtle to lizards and snakes, monkeys. Anything that is not basically farm animal or dog and cat is classified as exotic.
And when we think of vets, we think of dogs and cats, and then sheep, in Tobago particularly, sheep and goats and cows and horses. But we really don't think of the lizards and the snakes. Is that your specialty in Trinidad?
No, unfortunately, I was not able to specialize in exotics. It's a hugely interesting avenue in veterinary medicine, but even though we have the diversity, we have amazing diversity in Trinidad in terms of our flora and fauna, but financially, not too many people bring in their little manicou or their monkeys, and then to pay for that facility as well. A lot of people, it's a financial thing.
So what would you find would be the greatest type of patient that you have in your practice in Trinidad?
When you say greatest, you mean my favorite or the most common?
The most common animals that you help in your practice in Trinidad, which would they be?
Definitely dog and cat.
Okay, and occasionally you have the larger equine animals get called to go to them. Yes? Okay. Yes. All right. Now that is for your traditional, I take it your practice is known as a traditional practice primarily?
No, it's not. It's actually a regular Western practice.
That's Western?
Mm-hmm. Yes. So Western versus Eastern.
Okay.
And No, it's a regular Western practice. We do surgery, we have gas anesthesia, we do groomings, we do vaccines. So regular practice, and then I just specialize with the alternative medicine.
So tell us about that alternative medicine. At what point in your life did you become attracted to the alternative medicine, having had already a background in the what we call the Western approach?
It's funny. Between year 2 and year 3 vet school, I got myself a part-time job working for Dawn Stampley Rouse, and she does laser therapy and massage on people. And she was approached by one of the trainers at the racetrack to do laser therapy on the horses as well, because it's a great modality for reducing pain and swelling and speed up healing. So she said yes, and then but she needed help, and that's where I came along. And so that was my first exposure to alternative medicine, where you don't need drugs and you don't need injections and medication. And that was what opened up my eyes, because vet school honestly didn't tell me about these things.
They tend not to.
No. So that was my first exposure to that, and then I graduated thinking I was going to do surgery actually with equines, and that switched over the years to I was exposed or introduced to the acupuncture as a modality for, again, reducing pain and helping my patients with their mobility and their quality of life. So that was why I got interested in that. And I thought it was just initially, I mean, as I said, I had no exposure before. And when I started it, my eyes were opened as to the many, many ways that you can use acupuncture and alternative medicine to help your patients. As I said before, you don't need drugs. You can use herbal medicine for kidney ailments. You can use herbals for anxiety issues. I can use acupuncture as well for everything from anxiety to arthritis to slip disc to liver issues and even allergies.
And where did you learn animal acupuncture? Did you go abroad to do it? Did you do it in Trinidad? Where did you learn it?
Yes, I did have to go abroad. I did my basic veterinary acupuncture certificate with an institute called the International Veterinary Acupuncture Society. And I chose them because they're international, and of course I practice in Trinidad, as opposed to choosing one that is mostly American, and then I wouldn't be able to practice internationally. So it is recognized internationally. I can go anywhere from Australia to Belgium to anywhere.
But that was actually, that was training that you did in the US, correct?
Yes, I did that. They move around every year. That year we trained in Houston, Texas.
And how long is that program?
6 months.
And then when you came home, you were armed with the certificate qualification in animal acupuncture and any other modalities?
No, they start you off with acupuncture, but it opens your eyes, because again, they tell you that's where they introduce you to the herbs. So if you do the acupuncture, but you add this herbal medication, so for example, this one, Quiet Contemplative by Can Herbs. It's a Canadian company. That's used for both patients with arthritis, but generally used with patients with kidney issues. So I might have a very old geriatric patient, and I will get better results if I combine both the acupuncture and the herbal medication.
So your training involved the two of them. And when you came back, did you find it, Trinidadians, did you find the Trinidad clientele receptive to the idea of acupuncture for their snakes and their pet dogs and their cows?
Only the racetrack. At first it was only the racetrack, because they acquaint themselves with the international practices, the trainers there. They know what's done, let's say, in Jamaica and Miami and Canada. So they know that acupuncture is used a lot in those racetracks. And they were very keen on having it in Trinidad as well. Because to be frank, acupuncture doesn't test positive when you race a horse. So it is a way to reduce their pain and keep them running more comfortably without medicating them.
Ah, very clever. There's no trace for the animal might do really, really well in a race, but there's no indication inside that it had treatment of some kind.
Yeah, and I haven't medicated it, so it's completely legal.
Yes, fantastic. So you would have possibly had the opportunity to do this as a full-time job because there's a lot of racehorsing in Trinidad.
Yeah,
And
I would have, but then the racing industry took a sharp decline. And yeah, so we're not even sure if it's going to survive right now in Trinidad.
But there's still horses, even if not racing, there's a lot of horses.
Yeah, which is not always a good thing.
Okay. Okay. Now, if you had the choice, would you be specializing in resources, Leah, or are you happy doing your holistic practice with a mixed clientele?
I'm happy with mixed. I find it I love the fact that no 2 days are the same. You know, I get different horses. Sometimes they're grumpy. Sometimes I have a grumpy cat. Sometimes I have an amazingly peaceful animal who's just completely open and grateful for the treatment. So I really do love helping them where maybe Western medicine didn't.
And would you find that when the clients come to your clinic, what's the name of your clinic again, Leah?
Sapphire Vets Limited or Piaco Vets Clinic.
So let's say Sapphire Vets Limited. When people come, let's say they come for the first time, do you find it difficult to introduce them to the idea of the holistic healing? Or they come and they are open to you find that they're open, the Trinidadian clientele with their animals?
Most of the times, if they've found me for the acupuncture, it's because they are already open to it and because they've asked questions and or a colleague of mine has referred this patient to me for acupuncture. So, but otherwise, the regular responses, oh, they do that in animals too.
And then they let you, or then you say, no, I want some pain meds.
Yeah, no, I get that too. You know, like, doc, you treat people, and I'm like, no, I'm not certified or licensed to treat people. So only animals.
They could say, but people are animals too.
I've heard that one too.
Now, what other therapies do you personally do? Certainly you are the only licensed animal acupuncturist in Trinidad, is that correct? And Trinidad and Tobago, right?
If I'm not mistaken, I'm the only licensed one in the Caribbean. I wouldn't say in the region. I would say in the Caribbean because we have a lot of people who practice in South America and Central America.
So let's say in the Caribbean. And what other holistic modalities do you actively use in your practice?
I use Tuina, which is Chinese massage. There's a lot of overlap in terms of technique with regular massage. But I guess the methods and the way you do the massage, the names that are given to the different techniques, they're in Chinese. But I mean, essentially, it is just Chinese massage. Using and combining with acupressure.
Is it like shiatsu?
Can't say I'm familiar with shiatsu, sorry. But you use acupressure, knowledge of the acupoints, because I'm an acupuncturist, and you combine it with the massage to get a better effect than it's not just a spa massage. It's a therapeutic massage. And I also do herbal medicine, as I said. I do food therapy. I did a course in food therapy as well. So that's where, like Hippocrates said, let food be thy medicine. So a lot of the times your illness may be lifestyle oriented or because of what you're eating is not healthy for you.
I think unfortunately that's true for animals and our people these days.
Yeah.
So So you are able to convince owners that a change in diet might help reduce the conditions of the representation of illness for the animals, correct?
Sometimes.
Do you do courses? Do you give workshops or training on
No,
those?
no. So I'm still doing courses and training for myself. So I have not done any training. I recommend people to go to different places and get training, but I don't personally do any training.
Okay. And tell me something. Do you have any hints or tips for the Fire Tribe members who have animals? Let's say the standard dogs and cats and hamsters are not the snakes and the lizards. Do you have any takeaways that they could have from that would help them in a holistic way with their animals? Like, you know, we have Terry watching and she definitely has an animal who's very excitable. Terry, would you like to talk a little bit?
I'm sorry if you're hearing my dogs in the background. They're having a nice howl.
This is fine.
Yes.
This is about dogs anyway. This is about animals.
Yeah, yes, indeed. Sorry. I was trying to find the unmute button. You were saying to me.
So do you have any question for Leah that might that might help you with Mojo? Anything that you want to tell her about Mojo that maybe she could help you with?
Yeah.
Mojo is Terry's little dog. He's really, really cute.
Makes my sleep restless as well.
Say again,
Are
Terry.
you hearing me, Wendy?
No.
No, I was saying. Yes, are you hearing me now?
Yes.
Hello? Okay, great. Because I seem to be having problems with people hearing me on my phone today, and I'm using my phone for this. Right. I was saying that Mojo, my dog, my Yorkshire Terrier, tends to be very restless at nights, which makes it difficult for me to sleep because he wakes me up almost every hour on the hour to do checks around the apartment for I don't know what. So I don't know if it's some type of anxiety that he's displaying. I'm not sure because he does have issues with the anxiety, especially separation anxiety. It's just him and I. So when he's left alone, he cries and that kind of thing. But once I'm here, he's pretty much okay. Once he has my attention. But in the night, it's been pretty difficult. I've only just started sleeping with him in my room. He used to sleep elsewhere before we moved from Trinidad to Tobago. So I don't know if all of those things have affected his sleep routine. Any advice?
Hi, Terry. Okay, so when we have any sort of behavioral or anxiety issues, that's what we call a Shen disturbance in Chinese medicine. So that's spelled S-H-E-N, Shen disturbance. So, and yes, anxiety does fall in that category.
Okay.
And when it's nighttime, when you see it predominantly at night, it may be due to either yin deficiency or blood deficiency. Very commonly, what we call a heart blood deficient patient can have anxiety. And I say heart blood because Chinese medicine has allocated the different organs in your body and attach those names to the different meridians and channels that they've mapped out throughout your body. So you have the heart channel and you have the small intestine channel, which are husband and wife, by the way. And you always have opposites in Chinese medicine, just like you have yin and yang, and you have qi. So with a yin deficiency, the symptoms of whether it's kidney or heart or whatever, with a yin deficiency on the whole, the symptoms do tend to be worse at night. So anytime I have a patient that is worse at night, it does tend to be yin deficient. And a lot of times if you use blood tonics, so again, this is where the food therapy comes in.
Yes.
If you use blood tonics in their food, that helps because you're nourishing the yin, you're nourishing the blood, and it does help alleviate symptoms. Other than that, I usually recommend stuff like CBD oil for anxiety,
Right.
Or Chinese herbal medicines.
What kind of oil is that, Leah?
CBD,
CBD.
CBD.
Oh, CBD
Our
oil.
favorite.
Yes.
Hemp-based.
Our favorite.
When it's a dog, hemp only, not no THC allowed
No
for dogs.
THC. Okay.
Yeah.
And so you have those medicines available at your practice.
Yes.
Ah, okay.
And Leah, what,
But you come to Tobago. I remember Wendy was saying that you come to Tobago. When you come to Tobago, do you conduct clinics when you come here?
Clinics is a strong word. Usually if I come to Tobago, it's either I'm there on vacation or yes, I do come for work. Specifically, or I should say most commonly because of healing with horses.
Right. Okay. So okay, I understand.
Yeah, so I do treat their horses as well.
Okay.
now, Leah, would you say that the contemplative bottle that you showed us at the beginning would be something that would be good for a dog with this kind of this kind of anxiety? Because it sounded like a calming kind of treatment.
The name is, I don't know, they didn't used to have this name before. I don't know why they switched the name, but no, this particular formula, despite its name, would not help with anxiety.
Okay. And when you talk about blood tonics, would it also be as simple as giving the dog more organ meat, you know, liver and heart and gizzards as well? Yeah. Okay.
Definitely more beef liver, heart. Yes, definitely.
Okay. Terry, so you have some options.
Thank you. Yes, thank you.
You're welcome.
I'd like to welcome Nesha Rai. Would you like to say hi?
Hello.
Hello.
Do you have any questions for Dr. Leah Nesha?
Well, unfortunately, I now joined, so I'm not really sure what's going on, but I'm listening. Meanwhile,
Do you have any animals, any pets yourself?
yes, of course, I have 5 dogs.
Okay, so that's a great start. Do you have any dogs that have issues? Dr. Leah can help us give you guidance from her holistic point of view right now on the spot.
Actually, yes. I have a puppy that I rescued about 2 weeks ago. He was doing fine up till yesterday. He just stopped eating and he was real vibrant and jumpy and playing and stuff. And yesterday morning when I woke up, he just throwing up and he not eating anything. Up to this morning, I tried giving him sausage and he not eating it.
Okay. How old is your puppy?
Well, as I say, I rescued him recently, so I'm not exactly sure, but from my average, I would say he's like about 3 months or a little less.
Right. And that kind of unfortunately sounds like it might be parvo. So I would suggest that you probably take him into the clinic as soon as possible. Other than that, most important thing would be to keep him hydrated. Because the dehydration tends to be a huge factor because of course they're not eating, sometimes they're not drinking because they do feel like vomiting. So even though you may not be seeing any vomiting with the dogs, a lot of the times they just don't eat because they know they're nauseous. So if you're not seeing him eating and if you're seeing any diarrhea, then I would highly suggest you get to the clinic, maybe some fluid, but you can pop in the pharmacy today and pick up some rehydration salts or some coconut water and make sure that he's drinking. Very, very important, even if you have to syringe feed him.
Force feed him, okay.
Now, Nesha, I have to tell you, I lost a pup to parvo many years ago and it was heartbreaking. So I am urging you, don't hesitate, take the doggy to a clinic. If you don't know the history of the dog and he has been astray for 3 months, it's very likely he's picked up parvo from what, hanging out without any, vaccines or injections, protection. And it is really heartbreaking to see them die like that. So don't hesitate. If you love dogs, and for 5 dogs, it sounds like you do. I am a dog lover too. Please don't hesitate.
See them stray, and this one I had 4 already, and I said no, I don't want any more. And my husband was driving, he was on work driving, going up on Matura side, and he saw this little puppy on the side of the road, and he just had to stop and pick it up and bring it home because he know if I was in with him, I wasn't going to leave that dog on the side of the road.
Well, I like you guys already, and tell your husband he's a good man. But
Yeah.
right now, Leah, can that puppy give her other dogs parvo, or it's a function of age?
Usually if her dogs are over 2 years old, it will not be a problem.
Yeah. Dogs are big.
Especially if they're vaccinated. If they're not vaccinated, once they're over 2 years old, they should be safe.
Okay, but
No,
Nesha,
my other dogs are vaccinated and they are over 2 years old.
but Nesha,
Okay.
still to save that pup, take it straight to the vet if you could, and give it
Hopefully
coconut.
it's
all the
just
way
worms. I've seen dogs die from worms alone. So,
as
but
well.
you can't get vomiting with worms.
I want to believe it's that because before his tummy was very big. Like when he eat it would come out like a little froggy. So I want to believe it could be worms too, but I'm still going to take him to Saturday, yeah, because Sophia, I go to Sophia's clinic in San Piaco.
Is that not Leah's clinic?
And
Is it?
Piaco.
Sophia's?
Sophia? No.
It's right by not
Oh,
too far.
Sapphire.
Sophia, sorry.
Yes, that is our clinic.
Okay, well then you probably remember me then. Not too long ago, Minnie was by you. She had
Probably Dr. O'Brien, probably. So Dr. O'Brien.
yes, Dr. O'Brien was there.
But isn't it a small country we live in, eh?
Yeah.
So now
Yeah,
you go.
had a,
What time does your clinic close on a Friday there, Leah?
We close at 4.
Oh, all right. Nesha, first thing in the morning, right? Get puppy.
tomorrow morning, please God, yes. I will have to because I don't like how he's looking.
And we'll give him lots of fluids today, yeah? But take him straight in the morning, and please let us know how he does, because now you have us caring about your puppy. Okay?
Oh,
All right. I'm checking the chat. We don't have any questions on the chat. So I'm just going to say, I'm going to bring us back now to the view where we can all see each other. Nasha, would you like to turn on your camera so we can see you before we wrap up?
that video, that would be yes.
Yes, hi there. Okay, lovely to have you with us. So on behalf of the tribe, thank you all for joining us. Thank you, Dr. Leah, for giving us your fascinating journey and giving us stuff that people can actually use practically with our animals. And we look forward to more members of the tribe watching the replay and connecting with you as needed going forward. Many, many blessings to all of you. Thank you.